I think this is one of the biggest frustrations for individuals trying to get a Sjogren's disease diagnosis. And Becky reached out and said, I do too, on a video where I talked about all of the different symptoms that I have as a result of my Sjogren's. But she said, I tested negative though. Because Sjogren's isn't a simple, like, one blood test kind of diagnoses, it is a combination of blood test, physical manifestations, and typically a lip biopsy. And our blood work can fluctuate just like the symptoms of our disease can fluctuate. And so it's very, very, very common for a lot of patients not to have positive blood work because they don't have enough damage in their body yet. One of the things that I think is most important that I'm trying to help advocate for with Sjogren's disease patients is the potential of being a seronegative patient. So seronegative is a term used to describe that you have the disease, but your blood work is showing up negative. There is an article on PubMed that you can look up if you just search seronegative or seronegativity. Seronegativity with Sjogren's, and you can print that out, bring it to your doctor, and have a discussion with them to see if you might be a potential seronegative Sjogren's patient. The benefit of trying to get your doctor on board with the possibility of seronegativity and Sjogren's is that they can still start treatment and see if some of the medications that they commonly use for Sjogren's disease might help you. That can include medications like Plaquenil, Imuran, naproxen, or prednisone. Typically, those are first-line medications. But mostly, I just wanted to let Becky know, like, you're not alone. There are many patients that are trying to get a Sjogren's diagnosis or have all of the symptoms but are showing up negative. I hope that you can find information and resources in our community so that you can continue to try and tackle these symptoms with or without a diagnosis, because your pain is valid. As always, if you have other questions about Sjogren's disease or other related conditions, feel free to drop them in the comments. I do my best to answer back to as many people in our community as I can. And as always, I encourage you to hit that follow button to learn more.